Hi, I'm Dr. Jeff Banas, and in this video I'm going to talk a little bit about the orthotics we make here in our office in Mesa, Arizona. We can make custom orthotics for all types of conditions: plantar fasciitis, pain in the bottom of the foot, knee pain, ankle pain, back pain. I don't think people realize how the actually foot affects the knee, the back, even the neck. If you have an arch that's rotating or pronating too much on one side, that collapses that arch, that knee on that side can now buckle down, which means your hip's going to rotate down. You don't walk around like this, so your body's got to kind of balance itself out by leaning over like that. The orthotics are custom scanned to match your foot. We take the scans weight bearing and non-weight bearing, and then we also make any type of adjustments or wedges that we may need to do to help support overpronation, flat feet, supination. Bottom line is that these inserts that come into the shoes right now are pretty much useless. There's given no support at all. What I put most runners in, or people with back pain or knee pain, is a semi-rigid type of orthotic. This is my orthotic right here. I've been wearing this orthotic for about 5 years right now. I myself has a degenerated knee, chondromalacia patella, what's called, which means the cartilage under my kneecap has worn out. I also have pretty severe plantar fasciitis. I got the plantar fasciitis because I was running with or without orthotics, ran too long, the shoes broke down, and then I had little tears on the bottom of my foot. However, now with my orthotics, I'm able to run with no problem. With my degenerated knee, it inflames up once in a while, but I'm still able to run with it. I'm going to talk a little bit briefly about the orthotics, the styles of orthotics we have. Like I said, what I try to do is put most people in a semi-rigid one. I don't like orthotics that are too rigid. A lot of people are coming in here with knee pain, with back pain, and they already went to some clinic and spent $500, $600, even more on orthotics, and what we're seeing is a lot of people are getting put in really firm orthotics that have no give at all, and they're also getting put in heel cups. This is a big heel cup right up in here. I don't like putting heel cups in a decent running shoe. You already have a nice heel cup in this type of shoe. So what happens lots of times, if you put a big heel cup like this into a shoe like this that already has a heel cup, that's going to raise that heel up too high. Now you're running with that heel up, that just leads to more problems. So we are seeing a lot of people coming in with very rigid orthotics in heel cups, and it's not helping their condition, so they seek us out for further evaluation, and we tend to put them in a different type of orthotic that seems to work pretty good. Now, that doesn't mean I'm totally against heel cups. It all depends on the condition, whether you're a runner, walker, or what type of surface you're walking in, what type of shoe. We make all types of orthotics here. Basically what we do is when you come in, we have a consultation. We take a look at your feet, look at your back, your knee, whatever you may be having the pain. We take you through some orthopedic tests. We look at your back, we look at your knee, we look at your foot. If you're having back pain, we can't just look at your back. We need to look at the angles at the knees and the ankles. If you're having plantar fasciitis, pain on the bottom of the foot, knee pain, runner's pain, we need to look at the foot, the knee, the back. We need to look at the whole chain. We're not going to evaluate just the foot when you come in here for orthotic. What we do is we're going to watch you walk a little bit. We're going to measure your arches. We're going to have you sit down, measure your arches when you have no weight on the foot. Then we're going to have you stand up, and then we're going to measure the arches and see if one side's dropping more than the other side, or if they're dropping at all. We're going to also measure what we call a Q angle. We're going to measure a specific angle between the hip and the knee. We're going to then have you do some different orthopedic tests for the back, the knee, and the foot. Then once we get all that information together, we could go ahead and scan your foot, weight bearing, non-weight bearing, and then what we're going to do is make any adjustments that we do for the orthotics. We could build the orthotic up high. We could give you a little support. One thing we do quite commonly is put wedges in orthotics. So what happens here is if you're standing and if you're overpronating too much in one side, we might want to put some type of wedge in the orthotic, which is actually a little bit thicker on one side than the other. What that's going to do is bend the heel. This one here has a thicker wedge on the inside. So if you're going to overpronate, so if you're dropping, so a lot of people say when they walk, they're either pronating or they're running, they're pronating. We're going to make a custom orthotic for you that builds up that arch, but more than likely we're going to probably put what we call a medial heel wedge, which just means it's a little bit thicker on the inside than the outside. So what that's going to do is bend your heel a little bit and help keep that alignment. I'll post a picture after this that will show you what the wedges are going to look like. Couple things about orthotics is also once they're made, you're not stuck with them. We have 6 months that we can make adjustments. Most of the time, through the evaluation, the orthotics are right on and people are happy with them. I usually tell people to break them in a little bit. I personally, when I got mine, went off and ran an hour, never had a problem. Most people are feeling a lot better with their orthotics because you're actually correcting the issues. But sometimes there might be a little adjustment that may happen. You might just have to get used to them for a little bit. However, if we make orthotic for you and it doesn't seem quite right, we could just send those back to the lab. Sometimes we got to increase the wedge a little bit, decrease the wedge, build the arch up. My point is, when you get an orthotic through us, you're not stuck with that specific orthotic. We'll work with you and make the necessary adjustments necessary to really dial in that fit for you. Right now, currently, we charge $185 for our custom orthotic. That includes evaluation, the scan, the adjustments, anything that we need to do. Now, I know a lot of places are charging $500, $600, even more for the custom orthotics. If people call us up and they want to know what's the difference between our orthotics and their orthotics, and I can say there's really no difference. The only price is the cost. We just choose not to charge that much. Like I said, I've been wearing these orthotics right here, have been through 5 Ironman triathlons and 3 marathons. Everything's fairly good and in place. Like I said, I personally myself have a degenerated knee and plantar fasciitis on the bottom of the foot, and I'm a long distance triathlete. So I'm always looking for the best product or supplement or treatment out there to keep me going so I can continue my running, because it's what I enjoy. It's part of my lifestyle. And these are the orthotics that I have chosen to use for myself. So I never recommend anything to any of my patients or anybody that I haven't tested myself out. Also. So if you have some issues with your back, with your knee, with your ankle, with your foot, even with your head and neck, you might want to consider some orthotics. Call me up personally. Call my office up. More than likely, I'm the one that's going to answer the phone and talk to you. If you have some questions, we can do it over the phone, or you could, ideally, what you should do is call up, schedule an appointment, come on in, we'll sit down, we'll look at your knee, your foot, your back, look at some issues here, and see if an orthotic is something that could help you.